Hi, good afternoon. My name is Jeff Resnick. I'm Chief of the History of Medicine Division here at the National Library of Medicine. Welcome to everybody here in the auditorium, Lister Hill Center at the National Library of Medicine, and out there watching us through videocasting, through NIH videocasting. Before I introduce today's speaker, I'd like to share details of our next History of Medicine lecture, which will take place on Tuesday, April 12th, at 11 a.m. in the Ruth Kirchstein Auditorium at the Natcher Conference Center here on the NIH campus. Dr. Jeremy Green of Johns Hopkins University will be speaking on medicine at a distance about the effects of instantaneous digital communication on medical knowledge. Dr. Green's lecture will be, in fact, the keynote address at Images and Texts in Medical History, a workshop in methods, tools, and data from the digital humanities, hosted by the National Library of Medicine and funded by the National Endowment for the Humanities, and made possible through a multi-institutional collaboration involving the NLM, the National Endowment for the Humanities, Virginia Tech, and the Wellcome Library and the Wellcome Trust. Dr. Green's address will be live streamed globally and subsequently archived by NIH videocasting. And this videocasting and archiving is the arrangement for today and our lecture by our colleague Christie Moffatt, who's archivist and manager of the Digital Manuscripts program here at the National Library of Medicine's History of Medicine Division and its Images and Archives section. As a program manager, Christie leads the NLM team responsible for developing content for NLM's Profiles in Science website, an online archive featuring the collections of 20th century leaders in science, medicine, and public health. She also serves as chair of NLM's Web Collecting and Archiving Working Group, extending NLM's collection development policies to include born digital web content, including on the subject of the 2014 Ebola outbreak, which is the subject for her lecture today. Additionally, Christie serves as co-chair of the National Digital Stewardship Alliance's Content Working Group, this is called the NDSA, collaborating with members of that organization to develop case studies for the preservation of born digital content and to conduct the NDSA Web Archiving Survey, a multi-year project to track the evolution of web archiving programs in the United States. It's my pleasure to introduce our colleague Christie this afternoon, fundamentally because her work and that of her colleagues here at the library is so vital today for the benefit of researchers tomorrow. Please join me in welcoming Christie.
Hello, good afternoon. Thank you all for coming, and thank you to Jeff Resnick for inviting me to speak today. It's an honor to speak here at NLM and share this work and this perspective on web archiving with my colleagues here at the library and with the visitors here and online. For those of you who use Twitter, please feel free to use the hashtag NLMHistTalk, especially if you're listening remotely and wish to ask any questions at the end. So in October 2014, the NLM began an effort to collect and preserve selected born digital web content documenting the 2014 Ebola outbreak and its aftermath, believing that the news and information about the crisis, much of which was being shared online, had long-term value, was changing rapidly, and was at a high risk for loss. In my time here this afternoon, I'm going to talk about the development of NLM's Ebola Web Archive collection, including how we identified content for inclusion, how this work fits within the library's overall collection development policy, and some of the challenges that we worked through along the way. I will also speak to how this work advances broader national efforts, including the National Digital Stewardship Alliance, the NDSA, in which NLM is a member, and its national agenda for digital stewardship. This talk will not run through the whole hour, and I expect there will be plenty of time for questions and discussion afterwards if interest. So first, I'd like to start with a couple of broad definitions on the practice and reasons for web archiving in the words of leading organizations building community, tools, and standards around web archiving. The International Internet Preservation Consortium, the IIPC, an organization representing web archiving institutions in 45 countries, defines web archiving as the process of gathering up, people also use harvesting or collecting, data that has been published on the World Wide Web, storing it, ensuring the data is preserved in an archive, and making the collected data available for future research. To collect the web, organizations use crawlers, these are robots, spiders, in our case through the Internet Archive, to identify and capture content that belongs in a collection based on URLs that have been selected as starting points, also called seeds, and any rules provided by the collector initiating the crawl. You'll likely hear me use the word crawl throughout this talk as I describe content that we've harvested at a particular time. Web content is stored in a WARC format, which is the preservation standard for this content. Cultural heritage institutions are archiving the web with the belief that information published on the World Wide Web today will be the primary resources for future researchers. These resources reflect the record of scholarship and historical perspectives. They reflect changes in society and technology. And not only is this content valuable, but it's also at a high risk for loss. Websites typically undergo continuous transformation, contain multiple links, and can be quite dynamic. There's always the risk that web pages of interest will disappear or links go bad before content can be acquired. We've all encountered these types of file not found messages. Here, for example, is a screenshot of the same URL we've been crawling on a monthly basis. You'll see on August 20th, 2015, the content was there, and a month later, September 20th, the particular page was gone. Another problem is that sometimes the content available at a link changes or shifts, so the URL itself is valid, but the content no longer references what you wanted or expected it to anymore. Efforts to preserve links in scholarly literature call the combination of these two problems, that is, link rot and link drift, reference rot. And indeed, this is a huge challenge to the preservation of the scholarly record. Here is an example of a URL where the data is continually being updated. Numbers and even the level of detail describing case counts of Ebola in Guinea, Sierra Leone, and Liberia referenced on October 6, 2014 at this CDC URL are much different than what is provided a few months later on December 12th. If you had used that link as a reference for those counts given in October, that URL would no longer serve your purpose. Link drift can be much worse, actually, where the topic of a content at a link has completely changed. Other challenges to capturing web content include the variety and content types and code that can be difficult to harvest. The tools used to collect the web pages are not always able to capture these complex content types. The reality is also such that tools used for web archiving are always trying to keep up with the technology used for creating the web content in the first place. The National Digital Stewardship Alliance, whose focus is on building capacity for preserving our national digital heritage, calls attention to the reality that a significant amount of the data that permeates nearly all aspects of life, culture, and scholarship today will not be available at a library or archives unless attention and priority is paid to actively collecting born digital materials. The NDSA identifies web and social media as one of 4 types of content that pose urgent challenges to digital stewardship in their national agenda. NLM is taking action to acquire and preserve web content through the work of the library's Web Collecting and Archiving Working Group, which began with a pilot in 2009. Members of this group include librarians Delia Golden and Christina Womack of NLM's Technical Services Division, and John Reese and myself, archivists in the History of Medicine Division. The working group is sponsored by Jennifer Merrill and Jeff Resnick, with support from Rebecca Warlow and Ken Coyle and many others within the library. Our working group is using Archivist, which is a web archiving service of the Internet Archive, to harvest web content of interest to NLM. Archivist is a tool used by over 400 organizations across the US and around the world to harvest, build, and preserve collections of digital content. And while the Internet Archive is capturing a significant amount of data of content broadly across the web, through Archivist, NLM is able to collect more deeply in specific areas of interest to the library. Our pilot collection was a collection of health and medicine blogs, which aims to collect blogs reflecting a wide range of perspectives in health and medicine. The image shown here on this slide represents one such blog, Wheelchair Kamikaze, written by an author about his experience with multiple sclerosis. This collecting effort is ongoing, and we're still identifying new blogs to add. Since this pilot, NLM has developed additional thematic and event-based web archive collections, including a collection documenting the Department of Health and Human Services response to the H7N9 avian flu virus. This was our first experience documenting an event. A collection on autism and Alzheimer's resources on the web, which was developed as part of our National Digital Stewardship Residency program by Maureen Harlow. We've also been collecting our own institutional web presence, which we've been doing for quite a while, but are now doing so using Archivist. And then more recently, developing a collection on global health events, a broadly focused collection which includes the 2014 Ebola Outbreak collection, the focus of my talk today. On a very basic level, we are interested in collecting web content as we believe that anyone interested in studying 21st century history of medicine will want access to this material. And NLM is collecting web content as a means to help fulfill the library and its History of Medicine division's collecting goals, listed here on this slide. You can see quite broadly, NLM aims to aggregate and maintain for permanent access library materials, regardless of format, that fundamentally record progress in research in biomedicine and the related areas, illustrate the public perception of medical practice and public health, and multiple other areas, which you can learn more about in NLM's Collection Development Manual, available online at the URL listed here. So it's not a stretch to see how the topic of Ebola touches many of these collecting goals. And to achieve these broad goals, NLM collects in a wide range of formats and subject areas, including, and relevant to this talk, disaster management, emergency medicine, infectious diseases, and public health. And then within disaster management, NLM has an interest in collecting on many aspects of policies, medical services, and communicable disease control. Our guidelines for collecting go on to say that NLM may select examples of broader works on disaster management to document the public response to specific events or the social, political, and cultural context of public health. So this is perhaps where our web collecting on the Ebola outbreak is most aligned. So in October 2014, as the volume of news and information on the web about the Ebola outbreak grew, we saw this especially as the crisis hit home here in the United States. The need to gather and preserve this information for future researchers became increasingly clear. It's hard to imagine how one might fully explore and understand reactions in response to this crisis without access to the web and social media documenting the outbreak. Web and social media was both how news was communicated and the means by which our reactions and experiences were shared. And unlike printed news publications, paper correspondence and diaries of the past, some of which are lost to history too, it's unlikely that without the attention and priority called for by the NDSA and others, that this type of material would ever make its way into the library for future researchers. We cannot count on this material coming to us through a traditional deed of gift created someday down the road, like some of our older historical collections, which do face their own related collecting challenges in the acquisition of electronic records. We knew as soon as we decided to collect on Ebola that it would be impossible, of course, to capture everything. And very quickly we began the process of identifying and prioritizing material to include. Our first strategy was to reach out to a team within the library, the Disaster Information Management Research Center, who was already following this health crisis closely. DIMRIC, that's their acronym, is charged with organizing and disseminating health information resources related to disasters of natural, accidental, or deliberate origin. As this team had done with other health-related disasters, DMRIC had put together an information resource page on the Ebola outbreak, which they continued to update throughout the epidemic. This resource, shown here on this slide, served as a core list of web resources to include in our archive, including national organizations involved in the response. So here we have examples of content, and these are all from October 2014. From the USAID, the CDC, and the NIH, as well as international organizations, including Doctors Without Borders, the World Health Organization, and the United Nations. This list of Ebola resources also provided links to situation reports from affected countries. Here we have reports issued by the government of Sierra Leone, as well as key social media feeds sharing news, information, and reactions to the crisis. We set up crawls of the Twitter feeds of Dr. Tom Frieden, who is the director of CDC, the World Health Organization, the UN Mission for Ebola Emergency Response, UNMIR, which was the UN's first ever emergency health mission. We also set up regular crawls of commonly used hashtags, including Ebola response and Ebola. So tweets using that hashtag from a wide range of sources and all kinds of perspectives were also included in that collection. And leveraging this content selected by experts in disaster information helped our group get up to speed fairly quickly. We knew early on, however, that we wanted to go beyond this list and include even more perspectives on the outbreak in the web archive collection. We identified blogs and individual blog posts of health workers. Here is a post from an epidemiologist writing about her experience volunteering with Doctors Without Borders in Sierra Leone. And here is a series of blog posts written by UNICEF staff on topics including safe burials for controlling the spread of Ebola. We also aim to collect blogs and blog posts that conveyed the perspectives of photojournalists, public health policy researchers, scientists, and others who are communicating experiences in the field or their work and reflections on Ebola from afar. And then, of course, there was the news documenting the spread of the disease, including this June 3rd, 2014 article on the death toll in Sierra Leone, which at that time had risen to 5. And this plea from Doctors Without Borders posted on their website on June 23rd, 2014, that help was urgently needed and they had, quote, reached their limits. News also conveyed information about research and development of a vaccine. These stories we also sought to collect. We also collected some of the dramatic headlines as Ebola reached the United States. Here is the CNN homepage on October 1st, 2014. The news was everywhere, all the time, so it seemed. Much of it was communicated online, and it was a very big, very dynamic story, which made the need to clarify scope very important. Did we want to document Ebola in the United States or the epidemic more broadly? The epidemic and its aftermath? Should we collect through the rebuilding of a healthcare infrastructure in West Africa? And what about the story of the development of a vaccine? What would researchers of this archive want to see? We knew the story was big, but we didn't know at the time how big it would get or for how long it would go on. The story even turned very local for us with the arrival and treatment of an Ebola patient on NIH campus. The story got so big, you'll remember, the news itself became a story. Here's an article we collected on how the media stoked the U.S. Ebola panic. And in some cases, the news became a source of humor, with headlines like this one from the New Yorker, "Man infected with Ebola misinformation through casual contact with the cable news." There were many ways to approach the story, and we kind of wanted a piece of it all. Our web collecting group sought out this additional content, that is the content beyond the DMRIC resource page, by following the news and setting up Google alerts. And we also welcomed recommendations from other archivists, historians, and librarians in the library. We would discuss these recommendations and then consider such key factors as how much of a website we would like to collect. Did we want a particular document, like this CDC health poster providing instructions on how to put on personal protective equipment? Or go larger and collect whole sections of the CDC Ebola website, like this one created especially for healthcare workers. Collecting this would include that CDC poster, as well as many other posters for health workers that we didn't necessarily even need to know about. Or we could go even broader and collect the entire CDC Ebola website, which would include that section for healthcare workers, as well as sections on prevention, signs and symptoms, and others. And then that capture would include more content, much more content, including these public health posters, infographics, and flip books, photographs, and public health messages delivered by radio and video. The CDC Ebola site is actually a pretty easy example of one we aim to collect across broadly. The decision was much more challenging for websites or blogs that only have a small amount of Ebola-related content, where collecting broadly might yield a high percentage of unrelated content. Similarly, rather than adding the World Health Organization official statements one by one, we crawled the content of their Ebola page more broadly, which brought in a much larger number than we could have identified individually, including reaching back and getting this March 24th confirmation that the outbreak in Guinea was Ebola virus disease, and then the August 8th declaration that the epidemic was officially a public health emergency of international concern. Identifying those places where we could collect at a higher level or broader level to include these additional resources simplified the task of selection, and we hope created a more systematic and comprehensive approach to collecting, including much more related content than we could have identified one by one. And then future crawls of those pages would bring in additional content. Once selected, we also had to determine how frequently we wanted to capture certain types of content. Some materials we only needed to capture once, like a single blog post, and some we wanted to collect monthly and some weekly, depending on what we perceived as the rate of change of content and the value of collecting multiple copies over time. Social media is an example of something that we wanted to capture more frequently as it was continually updated. Between September 2014, when the United Nations Mission for Ebola Emergency Response, that's the UNMIR, was established, and July 31st, 2015, when its work concluded, for example, they had published over 2,700 tweets. We crawled this content regularly to continue getting these frequently posted updates. And then these frequencies of collecting needed to be reviewed over time as the situation itself evolved. Determining how long to crawl content was also a consideration. Crawling the CNN homepage that I showed earlier made sense in early October 2014, but as big as the story was, it didn't take long for the story of Ebola to be moved from the main page, the main CNN page, to the health section of the CNN website. And then the main homepage feature a completely different story. We didn't continue to crawl that homepage after then, though someone might have found that useful. As we selected and reviewed collected material, we would discover additional content of interest. Online blogs, articles, and tweets would reference earlier news stories and other documentation that we wanted to capture. These items were not among the embedded content within pages, but links to external resources elsewhere on the web, and would be typically considered out of scope for a regular crawl. As an example, on this slide, you'll see a blog post from NPR featuring a story on fraudulent treatments for Ebola. The story references a consumer warning from the FDA by linking to a page on the FDA website showing actions by the FDA to crack down on such fraudulent treatments. The post later links to a letter from the FDA, also on the FDA website, to a person who was advertising treatments for Ebola on his website. Since these materials were not embedded in or part of the NPR blog post itself, they were just links, they would not be automatically included in the collection. Researchers using this archive site would be presented with a not in archive message when attempting to access that content. There are ways to expand crawls to include this content, sometimes bringing in much more than needed, or one can identify, add, and collect external content as independent resources within the collection. But if we want to add that content, a decision has to be made. Just how much this is being done, going after all of that linked content, depends on the resource and the time available to thoroughly review the captured content. The more time that we can invest our skills as librarians and archivists to review the collection for quality and completeness, the more confident we can be that we are adequately fulfilling NLM's collecting goals and building a quality resource and evidence base for future research. As I've said, we wrestled with the scope through much of the collecting process, especially when the news coverage seemed to change once Ebola was no longer in the United States. While we followed the news to a great extent, especially in the beginning, we ultimately decided that we needed more than the presence and frequency of Ebola in the news cycle to determine when to stop collecting and in the future as a place to start. We are in fact still collecting. And the situation with Ebola continues to evolve, as evidenced by this update from the World Health Organization on a flare-up of Ebola in Sierra Leone last month. We've instead decided to frame our collecting around the World Health Organization's designation of the epidemic as a public health emergency of international concern, which it still is, and the World Health Organization meets to review this status every few months. The activation of NLM's Emergency Access Initiative, providing free access to books and journal articles to health professionals in areas affected by disaster, is another trigger for collecting. Prevalence in the news is still a consideration, but the news on its own is a bit more challenging ground to work from. The yellow text on this slide, these lists indicate the events that we've collected around. These triggers are now reflected in NLM's Collection Development Manual and a new format statement on web content, which will guide future collecting around topics and events, including on the Zika virus, which the working group began collecting on February 1st. We're once again starting with the DMRIC Information Resources page, including once again the key social media. We're looking for ways to bring in other perspectives on Zika virus, and again wrestling with the challenge of scope. What stories do we want this archive to include? What will researchers want to know? As of our most recent monthly crawl that took place on February 20th, we have 338 starting point URLs. And crawling these has brought in over 5 million URLs and 302 gigabytes of data. The collection is available for searching and browsing via Archivist's public interface at archivit.org. We're adding description information to each starting point URL and have started adding collection-level records to facilitate discovery through the NLM catalog. The working group is also engaged in efforts to support research and use of the collections. One can envision many opportunities for future research if these materials are preserved. These collections can offer greater diversity than traditional collections. We can bring in many more perspectives. And perhaps most key, these collections can be data mined in ways our not yet digitized collections can't be. Newer search engines, tools, and computational methods will allow scholars to find patterns, determine relationships, categorize documents, and extract information from these corpuses. We've already seen examples of research in this area. Researchers at Virginia Tech have examined Twitter data from a collection on Ebola that they harvested to study the spread of rumors about Ebola. Our Global Health Events collection is included in a current study led by Old Dominion University in cooperation with Archivist on the use of the popular social media storytelling tool Storify to describe web archive collections and to help guide selection for new collections in the future. And then later this year, the Global Health Events Collection will also be included in a Mining the Archive Challenge led by the L3S Research Center with Archivist Research Services, which aims to support creating tools and building research use cases of archivic collections, which will undoubtedly benefit web archive collections broadly. While it's impossible to predict how future researchers will use this content, one might speculate some interesting work might be done on using the data and resources from this collection to examine the international response. There's already been a lot of reflection on the speed of this and how the response might have been coordinated earlier. Work might be done analyzing the communication during the Ebola outbreak, including what information was communicated and when, and even just the way that people and organizations talked about it. Or maybe they'll want to compare it with the communications and response to the Zika virus. In addition to supporting research, the working group is building new web archive collections and looking at ways to support involvement of other NLM staff in collection and selection. A team at NLM's National Information Center on Health Services Research, for example, has selected content for a collection documenting the 50th anniversary of Medicare and Medicaid. We're also making plans to bring copies of content harvested using Archivist, which is currently stored on Internet Archive data centers, into NLM's digital repository to preserve them locally, and in the future provide access and discovery alongside other NLM collections. And we're also building connections and sharing experiences with other web archiving efforts across NIH, HHS, and then broadly through participation in the Federal Web Archiving Working Group, the NDSA, the Society of American Archivists Web Archiving Roundtable, and with other Archivist partners. I'd like to conclude by connecting this work back once again to the broader goals of the digital stewardship community, as stated once again in the NDSA's national agenda. A gap is starting to emerge between the types of materials that are being created and used in our society and the types of materials that make their way into libraries and archives. The stewardship community must recognize this gap, understand why it exists, and determine how it can be addressed at local, regional, and national levels. It is hoped that this collecting effort, along with those of other cultural heritage institutions, will serve to address this gap, and together we can build and preserve collections for future researchers. You can learn more about the collection. You can explore it yourself at archivist.org at this link. You can read about it in the History of Medicine's blog, circulating now, and you can see examples of content that's been collected in HMD's Pinterest page. So there's examples posted there. I've also provided a link here to the NDSA's National Agenda for Digital Stewardship. So this concludes my talk. I do want to open the floor to any questions that you may have. And remote listeners, if you'd like to ask any questions, you may use the hashtag NLMHistTalk, and Jeff will facilitate and make sure that those questions are asked. Thank you very much. Thank you. And if you're asking any questions in this room and you're using the mic, please use the microphone by pressing the red button right by the microphone. John.
Hi, Christie. Thanks so much for your presentation. I'm thinking about the CSC, or CDC, as a big contributor of content for this specific collection. How aware are they of our efforts here, and do they participate in the federal working group, and do they do complementary activities?
I'm not aware that they're doing an archive collection on Ebola And this was really developed kind of quite independently of the CDC. Though in the future, Zika virus and elsewhere, I mean, we would of course welcome any recommendations for content to collect.
And we're not aware of their own web archiving activities at all?
No.
Okay, just
No.
curious. Thanks.
Ken.
I'd like to go back to the very beginning of your lecture. Can you tell us a little bit more about WARC, the web archiving standard? What's captured? I assume WARC is a system of records, a metadata system. What's captured in WARC? What does that do for the archivist, and more importantly for the researcher trying to find this information in the future?
So that's a great question. So WARC is a standard, an ISO standard for web archive content. I don't want to embarrass myself by talking too much about it in terms of the technical detail, but it is a standard, and it came out of the work of the IIPC and the Internet Archive, and it kind of contains, stores the pieces, the various pieces of the website of what was crawled, and so that binds it together with metadata, and that is what is stored over time, and that is what is available for research, and that is what we would be bringing into the NLM digital repository to manage over time. Hey, Beth.
I'm interested in web records management, and I know that the National Archives has some plans about that, and they obviously are interested in gathering lots of government website records. So what sort of thing are they doing if they're crawling all of CDC? Are we also, how does that work?
So my understanding of how the National Archives is working with web content of the government is that they are they have set up a process whereby they will receive web archived content. But as far as I understand it, they're not actively collecting broadly across the government at this time. So it's up to the institutions, as we do, to collect our content. Yes.
Hi, Anne-Marie Hooper, and I'm a librarian. I was curious, are you collecting in other languages, or did you decide that that would be too problematic?
We do have some resources in other languages, and it would be because the CDC has information in different languages, French, so some of the languages that would be where the health posters and the communication, the public health information was distributed in different languages. So to the extent that they did that, we collected it. And then, we also, same with materials here at the library that we offered through Medline Plus in English and Spanish on the Ebola virus and other related content, we would have collected that. But that's about the extent.
I had another question. I was curious about the blog posts. I'm familiar with the Wayback Web and the content there, so maybe it's no issue, but does anybody complain about any rights issues with saving this information for the future?
I was thinking someone might ask that question. So our approach to collecting the web content has been that we are building these collections, we are creating these collections of web archive content under fair use. And that's not the approach that everyone takes, but this is draws or is inspired by the ARL Code of Best Practices in Fair Use, in which librarians came together and agreed that this practice was fair use, and we've kind of drawn from that. No one has complained, and there are limitations to doing, the web archiving under fair use, whereby if someone did complain and wanted that content taken down, that is something we would have to do. And we also obey robots.txt when it comes to the content, so that if someone had put, embedded that in the site, that we would not then push that and crawl where we were not welcome to crawl. Hey, Joanne.
I have a quick question more for the researcher community. Do you know of any researchers who've accessed this? I'm just curious about, I know we archive, but it's a different task to make that archival material available to researchers. So I'm interested in kind of learning about, while we're collecting these born digital items on topic-based, how would a researcher, what are we doing to make it accessible, researchable today?
Right. Well, the Archivist last year launched Archivist Research Services, which I can't wait to learn more about, but we're making the data available for researchers, and I think some of the work going on, this Mining the Archive Challenge that's coming up later this year, is going to show some examples. I don't know if our collection will actually be used as an example. It will be in this challenge, but we'll be able to see how researchers are using it, and it would be, I really look forward to it. I'm not aware of anyone using the collection now, aside from the research I spoke about with Old Dominion University, which I find really exciting. I think this really, the future will hopefully show, we'll see more of that. Sure.
How much of the data that was collected and crawled consists of videos? Like on the CNN webpage, it seems like there's a video associated with every story. If that was either ignored or somehow an attempt was made to grab the transcripts or something like that, because the video content, I guess sometimes isn't always easy to pull down or even sort through how much of the video is relevant.
Right. We did not ignore video. We did try to get the sites as they were, the content as it is, but the video for us was a challenge, and I know that we didn't get all of the video, especially the CNN pages. So I think that type of format is a challenge for web archiving, and it was something that we really we addressed it to the extent we could, but and I don't know the figures off the top of my head, but we do have lots of video on the site. And if there were transcripts, that could have been a different separate file, and that would have been included in the crawl too.
Hi. When you were talking about archiving hashtag, anything associated with the Ebola hashtag, and I guess, and this relates to some of the other things that were crawled, do you do any weeding for things that are like a lot of sort of bots on Twitter will just add hashtags just to get you to click on their things? Do you have to weed any of those sort of things out?
Right. I mean, so when we crawled using a hashtag, it was specifically in Twitter. And no, there was no weeding that went on. So the collection, there's a wide range of perspectives, and then, going through it and seeing just about, anyone who used that hashtag, there's going to be, a huge range of content, and some of it may not even be, relevant in terms of using that hashtag, but it may not be what some might consider high quality. There's just a range of quality, which is kind of a nice juxtaposition to the crawling of the official organizational web pages and getting kind of the official account. So it's kind of nice to include both types of perspectives. And then just weeding in general with the collection, no. Though I imagine that there's some content in this collection that we might not have chosen to include in the crawl. It was brought in kind of in this net that was cast as we provided the best instructions we could, but there will be unrelated content, and we really just have to do our best to try to keep that from happening and look at crawl reports and weed that out as we can in future crawls. But that's a challenge.
Hi, Christie. That was wonderful. Thank you so much. What I was thinking about, now that you have all these models, as you move forward, what would be some of the big challenges, either the intellectual challenge or the technical challenge or the labor resource challenge, because it seems like you should collect everything.
Yeah.
At least I think so from your talk. So if you could speak about that.
So models for future collecting, like around an event. You know, I think we just are learning from our experience as we move forward. I was, you know, when Zika virus was declared a health emergency by the World Health Organization, we were ready that first day. I mean, even before we knew the meeting was coming up, we had a feeling that it was going to be declared a health emergency, and so we could even kind of pre-select a few items to start crawling. But yeah, it's a real challenge to scope out a collection, and I think to a certain extent every event is going to be different, and the ways that are used to communicate about the event, you know, we're already noticing are a little bit different with Zika than with Ebola. I guess I compare those two a lot right now. But there are other ways to collect around, so for non-events, I can definitely see collecting around exhibitions in the library or other topics of interest to the library, either doing collections, kind of a one-time thing like the autism and Alzheimer's research, which was like a point in time, though we may choose to crawl that content again. But there are other, you know, some types of collections you'll want to just, you have a point in time, and others it will be over a period of time to be determined, or some, you know, long-term crawling. Models, yeah. I guess that's a tough question, yeah.
I'll just follow up. I think the examples you gave, I was thinking of as a model.
Yeah.
And successful models.
Thank you.
Christie, with that, we'll thank you very much for a great talk, and we wish you well with your work. You know, you've got great support here at the National Library of Medicine. I'd like to thank you and everyone out there listening. And a reminder again that Christie's talk will be archived at NIH Videocasting within the next couple of days for all to learn from in the future. Thank you very much, Christie.
Thank you.